Samantala, upang bigyan pa tayo ng karagdagang kaalaman at detalye ukol sa Omicron variant at sa transmission nito, ating po makakapanayam ang infectious diseases specialist na si Dr. Rontgene Solante. Maganda umaga po sa inyo, Doc. Welcome back po sa Laging Handa Public Briefing.
Magandang umaga, Yusek Rocky.
Po, Dok, matapos itong selebrasyon ng bagong taon, marami po yung nakaramdam ng sintomas ng COVID-19 at nagpositibo pa rito. Isa pong nakikitang dahilan yung pong paglaganap ng Omicron variant sa bansa. So kailan po ba natin masasabi na may community transmission ng variant na ito?
Well, sa situation natin ngayon, Yusek Rocky, no? With the enormous, when I say enormous number of people being positive with just a short duration of time, and most of them are manifesting with an upper respiratory tract symptoms, then I would say there is already community transmission of Omicron variant.
Opo. Gaano kabilis daw po makahawa itong Omicron variant kumpara sa iba pang klase ng COVID-19 virus? Mayroon na po bang bagong findings tungkol sa Omicron? Kasi noong una, Doc, itong Delta, sinasabi talagang lubang nakakahawa ng mas marami. Paano daw po itong Omicron?
Okay, so if we're going to base the ability of the Delta to transmit a single interaction, say isang positive, it can infect like 5 to 8, no? Now, the experts' opinion here is that because of these heavy mutations, the Omicron variant can be 3 to 5 times as highly transmissible as that of Delta. So anong ibig sabihin yan? So you can just imagine you have to multiply 5 times 3 or 5 times 5, then that's the number of possible contacts na talagang pwede niyang mahawaan with a single interaction, especially in enclosed space. And that's why we're seeing a lot of these positives now, not only in the community, no? We're also seeing a lot of this in the healthcare facilities. And most of the healthcare facilities now, I would say 1/3 to 1/2 of the total healthcare manpower are positive with COVID.
Opo, Doc, kasi bukod dito sa Omicron at Delta na pareho talagang mabilis makahawa, pero ano daw po yung masasabi ninyo tungkol po sa pahayag na umano'y natural vaccine daw po ang Omicron variant? Humihina po ba talaga ang virus kapag habang patuloy po ito nag-mutate?
Okay, unang-una, no, we have to take that particular message of a natural vaccine because we know that pag na-infect ka ng Omicron variant, once you recovered, kung maka-recover ka, then you still have an antibody, and that's why you are protected against a reinfection of an Omicron variant, no? But the fact that this is still a virus and the possibility that if you are infected, you can also still develop severe, then chances are medyo mahirap sasabihin natin na we just want to be infected so that we can have a natural immunity. So the point here is that even if you are infected with an Omicron variant, it doesn't mean that you are in your lifetime protected against COVID, because as long as there is mutation, as long as there is community transmission, then you can always get COVID. And how do we minimize and mitigate this transmission? It's only through vaccine, and we just not can't rely na magpa-infect ka. We still have to protect ourselves, and we still have to get ourselves vaccinated.
Opo, Doc Rontgene, may tanong po yung ating kasamahan sa media. No? Tanong po ni Red Mendoza ng Manila Times. Sinasabi na po ng WHO na hindi po dapat ipagsawalang bahala ang Omicron bilang isang mild na klase ng variant. So ano po ang dapat natin tandaan para hindi tayo maging complacent at wag maging pabaya sa banta po ng nakakahawang variant na ito?
Okay, so in fact, we refrain using the term mild lang, no? And in fact, CDC emphasizes that the proper term here is a less severe form of Delta. Because when you say mild, baka maging kampante tayo. And actually, on the ground now, we are seeing patients now admitted, even with mild symptoms, but because of their comorbidities, they are now in the hospital because of their comorbidities. No? So dapat hindi natin pagbaliwalain the fact that it can still cause symptoms, it can still cause an instability sa katawan natin. There is a possibility that they can still be admitted in the hospital, especially sa may mga comorbidities. And ayaw natin yung maghahawaan-hawaan tayo dahil that can also cause more shortage of people, especially the working population.
Opo, sunod pong tanong ni Red Mendoza ng Manila Times, sa ospital daw po kung saan kayo nakabase ngayon, ilan po ang mga pasyente na nasa severe and critical status, ilan po dito sa mga severe ay hindi bakunado, at may ilan po bang mga bakunado na maaring tamaan ng severe disease dahil sa kanilang comorbidity?
Okay, so more or less, no, we're seeing increasing numbers of the cases, no, and in fact, in the government hospital where I am affiliated, the daily cases are rising, and our policy is only to admit those with severe and critical. So medyo tumataas-taas na rin ang mga severe critical. And ganitong scenario ngayon, since marami-rami na rin ang nabakunahan ngayon, no? So makikita namin na mataas-taas na rin ang mga nag-severe critical na may mga bakuna na, no? But as we mentioned, itong mga patient na to are really the immunocompromised and those vulnerable. So when you talk about vulnerability and symptoms of COVID, ito yung mga talagang pwedeng ma-admit sa hospital and will develop severe and critical stage of COVID. Although if we compared this Yusek Rake with the Delta variant before, medyo mas less ngayon ang nagka-severe critical compared doon sa Delta.
Opo. May pahabol lang pong tanong si Athena Imperial ng GMA News on the shortened the quarantine protocols for healthcare workers up to 5 days for fully vaccinated healthcare workers. Gaano po ito kaligtas? Hindi na po sila makakahawa sa iba nilang kasamahan at sa mga pasyente?
Okay, so the shortened protocol of isolation and quarantine, no, is made because of the exigency that we need healthcare workers to man the healthcare facilities. Given the situation now that marami talagang nagpupunta sa hospital. Otherwise, we will have a breakdown of our healthcare facilities. Now, 5 days, is it safe? Is it lower risk to still get the infection? Ang importante dito na maintindihan natin, but once you only have a mild symptoms or even asymptomatic, on the 5th day, nakikita natin yan na bumababa na rin ang viral load. Especially if you are already asymptomatic on the 4th day and 5th day, then on the 6th day, pwede ka na makapagtrabaho. Now, the rider there is that when they also will be working in the hospital, we will still strictly implement that they will be following the health protocol, the wearing of the face mask, the face shield, and the physical distance, including the monitoring of recurrence of symptoms.
Opo. Tungkol naman daw po sa self-administered antigen kits, kayo po ba ay suportado dito? At ano po yung magiging epekto kung ito daw po ay ipapagamit na sa bansa?
Okay, so malaking bagay ang antigen test, no, because ang RT-PCR is you need to go to a laboratory. Now, if there will be now an approval of the self-administered test kit, it will help some of our client na pwede silang i-test nila yung sarili nila if they have COVID, and they can do isolation and contact tracing mas mabilis kaysa maghintay tayo ng RT-PCR, no? But tandaan natin ngayon na wala pa talaga tayong approved na self-administered test kits, no? And sometimes ang importante kasi dito na how will you interpret the result, okay? And what will you do with the result? So, kung gagawa naman tayo ng mga antigen kit sa bahay, we need to have a close coordination with a healthcare professional para lang we should be guided on how to use it and what to do after being tested with these antigen test kits.
Opo. I'm sorry. Doc, ano yung nangyari po dati? Meron tayong saliva test kit. Paano po ito? Hindi po ba ito pwedeng gamitin rin? Parang mas mabilis po ito bilang pang-test?
Yung sa saliva test, Yusek Roque, is also an RT-PCR. Nagkaiba lang to sa isang test dahil yung nasopharyngeal, no, at saka oropharyngeal. Ito saliva, but still an RT-PCR method ang detection itong saliva na test, which is only done by the Philippine National Red Cross.
Okay. Opo. Pero ano daw po yung pinagkaiba ng home testing kits kumpara po sa ibang klase ng antigen test? Tingin po ninyo ay kailangan na rin itong gawin? Sa tingin nyo, kailan ito magsisimula ipamahagi o ma-distribute?
Well, we need to wait for the FDA approval of all of these test kits, no? Para at least we will be assured that all of these are evaluated by FDA and the kits are also quality assured na talagang maganda ang sensitivity and specificity because if you are using any kit now na hindi approved ng FDA, baka mahirapan tayo sa interpretation yan. Especially yung si Kraken, no, na pag meron kang symptoms and then you will do the antigen test kits and then pag negative, baka kampante ka lang na okay ka lang, no? Now, remember, in our algorithm, no, for someone that is positive at this point in time na merong sintomas and then antigen test kit is negative, kailangan mo pa rin mag-party PCR to really confirm if you have COVID.
Opo. At kapag wala po kayong access muna magpa-test, isolation po, quarantine talaga muna yung dapat gawin. Ano po, Doc?
Yes, napaka-importante ngayon, no? Once you have the symptoms, you have to isolate and you have to tell all your household na to observe also for symptoms and do self-quarantine dahil napakataas ngayon ng hawaan sa workplace.
Opo. Doc, ano po ba daw yung concerns ng FDA at DOH kung bakit hanggang ngayon ay hindi pa po daw aprobado gumamit ng home test kits?
Because wala pa talaga tayong approved na home test kits, no? So kagaya ng mga gamot na ginagamit natin, no? We need an EUA for that. So for proper evaluation and on that note, we also need this including also sa mga diagnostic tests kasi nagliliparan talaga ang different diagnostic tests ngayon na hindi natin alam ano ang validity, ano ang quality nitong mga diagnostic tests and we don't want people using a test na hindi natin alam kung ano ang magiging performance because they'll be spending money na hindi naman maganda ang mga test na to kung hindi evaluated ng government natin.
Opo. Doc Solante, sa tingin ninyo itong surge na nararanasan natin kasi yung sinasabi po ng ating ilang eksperto sa Africa, isang buwan po lang tumagal. Sa tingin ninyo, ano po ang gaano tatagal itong surge na nangyayari sa atin ngayon dahil sa Omicron at kasama na rin po yung Delta?
Well, mahirap mag-predict, no, at this point in time, no. Ang alam lang natin na itong Omicron variant at this point is really causing massive transmission in the community. And the only way na ma-predict natin na hihina ang kaso is if we will truly and strictly follow the health protocol because the health protocol, the wearing of your face mask, the face shield, including observing physical distance is the immediate important aspect of the barrier against getting the infection and follow it up also with your vaccination and giving the booster will you have an added protection that you will not develop a more severe infection.
Opo, panghuli na lang, Doc Solante, may mga nagsusulong din po na posible daw pong isa-ilalim muna sa alert level 4 ang ilang bahagi po ng Pilipinas, yung pong may mga matataas na kaso ng COVID. Ano po ang masasabi niyo dito?
Well, I think alam naman natin na ang escalation to a higher alert level will always be dictated by the number of cases. So, I mean, with the hospital facilities now, shortage of healthcare workers, and most of those patients with high transmissibility sa community, then I would think, in my opinion, we need a higher level than what we have now.
Opo, Doc Solante, kunin ko na lamang po yung mensahe ninyo para sa ating mga kababayan. Ito po yung sa gitna ng patuloy pa rin po natin laban sa COVID na sinamahan po itong Delta at Omicron. Go ahead po, Doc Solante.
Yes, thank you for this opportunity. No? So again, we would like to remind everyone no, na napakataas ng transmission ngayon ng Omicron variant. So importante dito ngayon is you have to take into consideration, very important, when you have symptoms, you need to isolate yourself. For those who have been exposed, then you have to do quarantine, no? Huwag tayong mapagkampante na wala kayong naramdaman because when you go to your workplaces, you can be a potential transmitter of the infection. But of course, yung kampanya pa rin natin na to go for the booster vaccination, especially for the vulnerable population, which will give you added protection in the prevention and protection against severe form of COVID-19.
Opo, Dr. Solante, kami po ay nagpapasalamat sa inyong impormasyon at sa inyong oras. Dr. Rontgene Solante, infectious disease expert. Mabuhay po kayo and stay safe.